Hi guys, how are you all? Hope you all are fine. Hope you all are enjoying. Welcome back to my YouTube channel. Today I had prepared a topic very vital, that is Guillain-Barré syndrome in very short. So what is a Guillain-Barré syndrome or what is a GBS syndrome? It is a rare, serious and rare disease, neurological disease which is characterized by demyelination of nerves leading to autoimmune disease, autoimmune demyelinating disease, which leads to progressive paralysis. There is a numbness and tingling in the muscles of the lower limbs. So we will see what are the causes of the GBS syndrome. The first, this GBS syndrome is mostly secondary to the viral illnesses like mumps, measles, influenza, Coxsackie virus, Campylobacter, then also influenza virus, also due to trauma also. So these were the causes, the secondary to all these illnesses. What are the clinical features of the Guillain-Barré? The first symptom is the pain in the lower limbs associated with numbness and tingling. There is the muscle pain. It radiates from lower limbs to the trunk and to the upper extremities. The tendon reflexes are altered. The plantar reflexes is normal, and there is a hypotonia. There is a cranial nerve involvement in 3 to 4 cases. If the intercostal muscles are involved, there will be respiratory insufficiency. Then, if the autonomic nervous system is involved, there will be retention of urine. There will be hypertension. There will be orthostatic hypotension. So, there will be facial nerve involvement. There will be neurogenic pulmonary edema, and these are all the clinical features. Mostly the main symptom is pain in the lower limbs leading to weakness of the muscles of the lower limbs and numbness and tingling in the lower limbs. So how are you going to diagnose the patient is suffering from the GBS syndrome? First is by the clinical manifestations, okay, and by the nerve conduction studies, then electromyography, um, by doing lumbar puncture. The CSF examination reveals the hyperproteinemia. That is, the proteins are seen in the cerebrospinal fluid in the lumbar puncture. So now we will see what is the differential diagnosis. The first is the Miller-Fisher syndrome. It mimics the Guillain-Barré syndrome, but it is differentiated by Guillain-Barré syndrome by the symptom, which is having acute ophthalmoplegia. The Miller-Fisher syndrome have acute ophthalmoplegia. Then the second is poliomyelitis, then polymyositis, cerebral ataxia, then this thing cerebral ataxia, then spinal cord compression, so heavy metal poisoning, botulism. These are all the things which mimics the Guillain-Barré syndrome. What is the treatment? First is the plasmapheresis. Second is the immunoglobulin therapy, that is receiving the antibodies from the donor intravenously. So this was about Guillain-Barré syndrome. Hope you like my topic. I had prepared in very short. It is a huge one. I had skipped the pathophysiology, but I had prepared the vital things in very shortly. So hope you like the topic. Please hit the button like, and share it if it's possible.